These days, we review anything from plumbers to hair salons to digital cameras, but we don't really put any scrutiny or look into anything in regards to our bariatric surgery. What? I've lost over 130 pounds after having the VSG surgery. I was sleeved in early 2019, and since then, I've been hearing from my fellow VSG sisters that they have some really big issues with self doubt and building those skills. So that's what I want to do here on this channel so that we can have more, do more, be more. Okay, let's go. Surgery is only one tool. It's time to add the other tools to the toolbox because it's your body, your health, your life. These days, we review anything from plumbers to hair salons to digital cameras, but we don't look into who, what, why, how about our bariatric surgery. It's okay to shop around for your bariatric surgeon. In this video, I'm going to give you a list of questions that you should be asking your bariatric surgeon and our team. Make sure you stick around to the end because planning ahead will ensure that you have a successful procedure, you heal faster, and you have a smoother recovery. Don't you want that? Weight loss that includes bariatric surgery is a lifetime long-term commitment. It is not a one-time, one-off procedure. Good and long-lasting results really comes from committing to the education that we've been given, doing our due diligence, researching, planning, and preparing, and that includes before, during, and after the surgery. Finding a bariatric surgeon who really wants to understand you as a person, your unique situation, and provide you the information on all best options for you is super important. So by asking these questions or any other questions that you may have is in your best interest because this is a life-changing event and you want to have a team that's behind you 100%. Studies show that the more experience, the more expertise the surgeon has, the lower their complication rates are. The following questions are some examples of what you could be asking to get at what their expertise is. What are your certifications? Have you written any books? Any research that you've published? Any articles that you've written? Are you part of any active associations? How many surgeries have you performed? What types of surgeries have you performed? What's your success rate? This one's going to be tough, but it's super important to ask, what is the rate of your complications? In addition to the complications, what are the risks of this surgery? Is there anything I can do before that can reduce the risk of complications? Can I speak to one of your former patients that had the same surgery performed? Where do you perform your surgery? What certifications or qualifications does your surgical team have or your office staff have? How can I reach you with further questions? Do you have a dedicated personal cell phone? Can I reach out to you on social media? How many 5-star reviews do you have? The big question to end with is, why should I choose you? Personally, I really like this question and I like to get the responses because it's not just the surgery. It's a good year, if not years after, that you're going along with this person on a journey, a lifelong journey of changing your life for the good. So be honest. Were you just going to go to the appointment just kind of blind off the cuff and just see what they were going to say, or were you going to be prepared? Or have you already gone to the appointment and you're thinking, ooh, I need to reschedule? So put down in the comments either honest or put down reschedule. Let me know. So here's the thing. For most people, the biggest thing is the anxiety around the actual procedure and kind of right after the recovery part. Because for a lot of us, this is brand new. And for some of us, this is maybe even the first surgery. So it's super important to ask these questions to make sure you know or can kind of get an idea of what's to come. So the big one is, and if they don't have the answers, they have a team that can help you find the answers. And I would also promote that you do extra on top of this, but you want to know what is covered by insurance. Is there any expectations that you need to pay something out of pocket? Big question. Sometimes it's overlooked, believe it or not, but you do not want to go down this road without knowing exactly what is your responsibility and what will insurance cover. Then you can ask things like, what kind of technology are you going to be using? There's some new technology, updated technology out there. You want to know, what are they going to be using? What technology and what materials are they going to be using in your surgery? You want to know, what is your recovery time? Now, everybody heals a little differently and it might be a little bit different, but they can give you a general range. And how active can you be during that recovery time? And how much time do you have to take off of work? Now, for me, I wanted to know the exact surgery, the type of surgery, and what were the logistics. Explain to me, like I'm brand new, what are you going to be doing in this surgery? Now, sometimes they might have videos for you, but you want to know exactly. You don't want to guess or assume what they're going to be doing. You want to know exactly what is the procedure and what are they going to be doing to your body. What should I expect in terms of a wound, or how do I take care of those wounds properly? What medical tests am I going to need before, during, and after? How long will the actual surgery last? How much prep time does it take? And then, how long do I have to stay in the hospital? Is it one night? Is it 2 nights? Every program's a little different. Every person's a little different, but you want to have a good idea so that you can prepare how long your hospital stay will be. Of course, you want to know, will I be in pain after the surgery? Once again, everybody's different, but you want to get a good idea of like what kind of pain is going to be happening, what should I be looking for, and then what can I do to relieve that pain? And then you kind of want to know, how many follow-up visits am I going to need? Now, every program's a little bit different, but you want to have an idea so that you can prepare and plan for that. And you need to go to the follow-up appointments. Super important. This is not a one-off situation. This is a journey that you need to partner with the surgeon, the nutritionist, and the team. Now, I might get some backlash with this, but I believe, and a lot of people out there believe, and even my own bariatric surgeon believed, is that the bariatric surgeon does not pick the procedure. They should be presenting to you the types of procedures, what would be the best in their opinion for your situation, and then give you the information regarding what that procedure is, the recovery time, what it'll do for you, what it won't do for you, and then you make that decision. It's not the surgeon making the decision for you. You're in a partnership together, deciding on what's the best situation for you. Now, once again, insurance could have a good play, be a game player in this, but you get to make a decision after doing all the research regarding the procedures and what will work the best for you. So the surgery itself really only lasts a couple hours, but as you should be aware that this is a lifelong journey. This is a lifelong commitment. So these are the questions that I think, as well as the other questions we discussed, these ones are super important. I think a lot of people skip over them. They just kind of think, oh, well, I'll figure it out once the surgery is over. They're so super focused on the before and the during that they forget that this is a lifelong journey. So you can ask questions like, am I a good candidate for this surgery? Why is that? And if I'm not, why not? The big question you want to ask, and everybody is different, is how much weight should I expect to lose? What do they suggest once I hit a plateau in a stall? And if you're new, here's a pro tip: you will stall and have a plateau. So maybe your surgeon has an idea on what to do when that happens. Generally, what will life be like after surgery? 3 months, 6 months, a year? What changes should I expect? What things should I be looking for that would give me cause of concern? Is there something that I should be preparing and looking for as I go through immediately after surgery, 3 months, 6 months, a year? What do I need to mentally and emotionally prepare, as well as physically prepare before having the surgery? Are there any foods that I'm just not allowed to have after weight loss surgery? Will I need to take supplements? If so, which ones, how often, and where can I find these supplements? And here's one that I think people don't ask for many reasons, but it is a super important. If you've been there, you know what I'm talking about. You want to ask about bowel movements. You want to ask about dumping syndrome. You want to ask about pains in certain parts of the body. You want to ask about reflux. All these kinds of things that do happen, these changes do happen, and you want to know, is that normal? What should I be looking for? When does it become a concern? Now, these questions, it might take 1 or 2 or maybe even 3 appointments, but your surgeon should not rush through this consultation. If your surgeon rushes through the consultation, you have to ask yourself, is this the person or is this the team for me? So ultimately, how are you going to make this decision? Well, really, it's up to you, but you're going to kind of decide on, after asking all these questions, what is your comfort level? Comfort level with their knowledge, their expertise? Does your personality jive together? Do you like this person? Do you have confidence in their team? Do you understand what the procedure is and the recovery time? And are they going to be there even after the surgery and the healing time? Are they going to walk with you on that journey during the one of the biggest decisions, life-changing decisions that you're ever going to make? So the questions we talked about should give you an idea of how comfortable you are with the surgeon and that you're making the right decision. Now, if you aren't comfortable, there's certain areas that you're going, I don't know about this. It's okay to take time, and it's okay, and I empower you to interview other surgeons. This should be the right person for you, the right team for you, because it's not just one day in the surgery center. It's a good year to many years that you're going to be working with this person and this team. So you want to make sure it's the right person for you, the right procedure for you, and you need to feel as confident and comfortable as possible. If you found this video to be valuable, please give it a thumbs up. Share it with the people that you think need to ask the questions, or maybe you need to stop, rewind, write them down, and reschedule that appointment with your surgeon and make sure you plan and prepare. It's your life, it's your body, your health. You need to be prepared. Okay, have a great day. Take care.